Hi, my name is Andrea, and I am a registered nurse. I've been a nurse for 16 years, and I'm also a mother of a son who is intact. And I made that decision pretty much like 17 years ago when I was in nursing school, and I saw infants circumcised during my OB rotation. This was in the late 90s, and I saw 2 infants who were strapped down in circumstraints. That was the first thing that shocked me. Well, actually, the first thing that shocked me is that these parents would relinquish their children, which I'm sure they still do today. They would relinquish their children to have this procedure done without any question. The children were brought into the room by themselves with the doctors or the nurse, and they were strapped down into these funny little boards, which I now know are called circumstraints or circumcision restraints. So the infants were strapped down, and what really stands out in my mind, besides the horrific pain that these infants were obviously going through, and it was the most horrific thing I saw in my whole nursing education. And I went in that room blindly, assuming the circumcision was very routine. It was something that was just done. Having been the daughter of a father who circumcised, not knowing any different. Went in there, knowing what I know now, there was no way I could have stomached what I saw in there. And the children are given little to no anesthetic. The anesthetic that they're given is an injection in the head of their penis.
Were the children that day, 16 years ago, were they given any kind of anesthetic?
I believe that I remember an injection. It was probably lidocaine. That, of course, was very painful. Knowing what I know now, you need to let that medication sit for a while. It's also not supposed to be given to children, especially newborns. I saw, not knowing the anatomy of a penis really and understanding of foreskin, I saw that they had to actually rip the foreskin off of the head of the penis with an instrument. And of course the baby is crying the whole time in excruciating pain. And for someone to say that a child's not having pain or that they won't remember it, as a nurse, like, the first thing you're taught is how to look for the signs of pain, and everything that I saw were that these children were in pain. And I saw 2 infants side by side being done at the same time, like assembly line fashion, and one of the infants was done by a medical student. So the medical student took probably 3 to 4 times longer than the seasoned pediatrician who was doing the other infant. And I could see that the med student was about to probably pass out. He was going really white in the face from having to do this to an infant. And I thought to myself, would these parents knowingly relinquish their child to a med student, knowing that this guy had never done it before, knowing that they're giving up their precious son to somebody to cut like that when he's never even done a procedure like that? So I think people have no idea what they're agreeing to when they agree to something like this. I mean, they willingly don't even go into the room knowing it's going to cause pain. They know that, but yet they still do it. And they think it'll take care of all sorts of problems for their son, and a little Vaseline's going to take care of everything afterwards. But horrific. I made the decision after that no child of mine would go through that. I now have a almost 3-year-old little boy, and he's beautiful, and I wouldn't change anything.
Thank you, Andrea, and thank you for coming out here today with Intact Seattle, Intact Washington, here at Pike's Place in beautiful downtown Seattle, Washington.
Thank you for being here, Brother Kay. Doing the work that we need to do.
You can count on it.
All right.
Not till they stop this insanity.
That's right.